We're seeing a number of new drugs come through, and I think that whilst it's important to try to extend survival and try to improve cure rates, the burden on our patients can be significant, and that needs to be mitigated as far as possible. So within the SPIRE trial, we've been able to see, although there are increases in myelosuppression, we don't believe that it's impacting in terms of symptomatic toxicity based on the data we've seen so far. I think more broadly, we need to see more in this area. One of the most important pieces of data that we've seen, I think, at this meeting in prostate cancer has been around the use of radium-223 in patients with advanced prostate cancer. And there's been data presented from a study where radium was combined with Abiraterone. And that trial was actually halted early because of concerns about increasing fracture risk. The data's now been presented, so we've been able to actually scrutinise it. There is an increase in fracture risk. What's interesting is that actually it appears you can mitigate this with the use of bone-targeted agents, so either bisphosphonates or denosumab. And I think what's striking is that probably many people have not paid enough attention to bone health and prostate cancer. What this study, I think, shows is that you can deliver radium safely, albeit not in combination with Abiraterone. It's going to be critically important to assess our patients at the beginning, at diagnosis, and then probably sequentially through treatment to understand whether or not they have a risk and whether or not they do need treatment, for example, with bone health agents. The rate was relatively low in that trial, and that probably reflects other practice and other studies also. What I think we lack at the moment is a clear idea about how we should assess patients at baseline, and also what the optimal bone health treatment actually is. So there's clearly need for more work there, and I think that will feed into quality of life, because skeletal mobility in that disease is a significant problem.